Welcome to Educators Podcast. My name is Swapnil and I work as an intensivist in Sydney. And today we have a very special guest in our studio. Her name is Dr. Liz Gaufberg from Boston. Welcome, Liz.
Oh, it's a pleasure to be here, Swapnil.
Thank you. Liz is an associate professor of medicine and psychiatry at Harvard Medical School, and she's currently a Gene and Harvey Picker Director of Arnold P. Gold Foundation Research Institute. For almost 3 decades, Liz's professional home has been the Cambridge Health Alliance, an incredible mission driven public institute where she has been trained in both internal medicine and psychiatry. Liz currently directs the CHS Center for Professional and Academic Development and leads the Developing Physician courses for HMS and CHS students. She serves as a core faculty at Harvard Massey Institute program for educators, where she is responsible for provoking deep consideration of core assumptions about learning and helping scholars to make visible, influential, yet hidden forces within our learning environments. Leeds finds the art to be a powerful catalyst for medical trainees and faculty to reflect on experience, build relationships, grapple with ambiguity, and integrate soul with role. She serves on the HMS Arts and Humanities Initiative Advisory Group, founded a CHA literary arts journal and art gallery, and she has established active collaborations with Boston area art museums. Liz's interests are broad and include preventing and ameliorating burnout, keeping healthcare human in our technological age, co production of healthcare and educational service, responding to discriminatory behavior in healthcare settings, and cultivating communities of practice. Her innovative curricula on professional boundaries, the stigma of addictions, and the hidden curriculum are in use in hundreds of medical training institutions worldwide. She is married to Slava, who is an emergency physician and musician, and together they are raising 4 daughters. It's my great pleasure to have today Liz Kaupberg on this show. Welcome, Liz.
Oh, thank you, Swapnil. It was wonderful to have you as a participant in our Harvard Massey Museum elective.
Absolutely. I think it was great pleasure to be on that session, and I'm very glad that I chose that elective because it was one of my most favorite session in entire Harvard Massey educators program. In that session, I was very fascinated with this new teaching method that you introduced to us called as visual thinking strategy. And I think you're going to tell us more about this method in this podcast.
Yes. Well, as you said, VTS stands for Visual Thinking Strategies, and VTS is a method that was developed in the 1980s by a cognitive psychologist named Abigail Housen and a museum educator, Philip Yenawin, as a teaching tool, which was designed to sharpen observation, interpretation, and communication skills. Um, and it's done through interactive group discussion around a work of art. This method was initially used with school children, but now has been adapted for many other contexts, including health professions education.
Okay. Uh, can you tell me more about what happens in a VTS conversations?
Sure. In some ways, the method is simple, but it takes a lot of practice to get good at facilitation. VTS involves giving the group first a few moments to quietly observe the chosen work. We also often cover up the tag, the description next to the work of art, so people aren't influenced by that. And then VTS really involves asking three questions. And these three questions are first, what's going on in this picture? Second, what do you see that makes you say that? And finally, what more can we find? The first question, of course, pulls for your initial sort of impressions um, about what's happening. you're beginning to sort of create a story or make meaning. But then the second question, what do you see that makes you say that, um, invites the participant to ground um, uh, their ideas in actual data and observations. And then so that we don't try to close in too prematurely on um, some explanatory model for what's happening, we continually ask, what more can we find? And so we just go around with those questions, um, as well as using facilitation skills to sort of support the conversation. For example, the facilitator would paraphrase every response from a participant and then begin, as the conversation unfolds, to link ideas to each other. It's important to use kind of speculative language rather than confirmatory language. So saying, oh, you're curious about this, or you're wondering about that, to model sort of enthusiasm and encouragement for the sharing of ideas, and to listen carefully. Those are some of the key facilitation skills. And this is different than other forms of small group facilitation that we use in health professions education, um, where even if we're using questions, we may also be guiding our learners to certain answers or teaching points that we want them to take home. BTS is really about making meaning as a group. And then finally, after we go through the conversation, which may take, 20 minutes, more or less, we then step back and ask the group, what just happened here? What happened as we looked together? Um, we also ask the group to comment on what the facilitator did. Um, and then when we're with health professions education groups, we ask the group to make linkages between what we just did with the work of art and people's experience in health as healthcare professionals or health professions educators.
Okay, so I noticed that you mentioned about that this method was initially used in school children, and now we are kind of using this method to health professional education. What are some of the health professional goals that VTS might help with?
Oh, there are so many. So honing observation and interpretation skills, interpersonal and communication skills, sort of team building and teamwork, because the group is really working together to come to their interpretation, developing reflective capabilities. And you can really get into examining assumptions and values, biases, even sort of cognitive biases in medical thinking. Um, and VTS can also support and serve as kind of a platform or priming for other museum based educational offerings. Also, just being in the museum setting helps to prevent burnout and foster renewal. It's just a beautiful place to be away from, the clinics and the wards and the
Mhm.
classrooms. There are other goals as well, which we can bring out in conversation.
Okay, so you mentioned about the these various goals, but what are some of the ways that VTS is used in health professional education? Can you please provide one or two examples, please?
Sure. Well, we have a wonderful course at Harvard Medical School that's led by Dr. Joel Katz and Shaw Hoshbin and Judy Murray, who is a museum educator. It's called Training the Eye, and the subtitle is Improving the Art of Physical Diagnosis. And VTS is a core modality in that course. And it's sort of based on the premise that observation skills are at the heart of physical diagnosis, and that these skills can be developed by facilitated discussion with works of art. So that's one example. We have courses also at one of our affiliated hospitals, Brigham and Women's, where they bring entire teams to the museum, multidisciplinary teams with learners and attendings and nurses and social workers, and they use VTS again as a core modality to build relationships and to think about teamwork and issues of power and how whose voices are heard on the team. You can, in the VTS conversation, no one's observation is privileged over anyone else's. No one is an expert on a close looking exercise with a work of art. Whereas in the hospital setting, we do have people with more expertise. And so having these conversations in the museum helps a little bit to level the playing field and think about the value of everyone's role on a team, even though roles are different. So the conversation, then especially the debriefing, can really help with learning about sort of interpersonal and team-based skills. We also, I will often bring learners to the art museum for their first session together in an orientation to a new course. And we'll start with VTS as a way of priming them with close looking, because it really is, I think there's a statistic that when people go to the museum, they spend on average 7 seconds in front of any work of art. And I know that's true for me, and just in life, we're often distracted and we don't attend deeply. And it's an absolute privilege to have some time to do that and to do it together with a group. So we often will start with VTS and then move on to other exercises that are more reflective practice. So where we might start with an open-ended question and invite people to find a work of art that, for example, has something to say about a value that they hold dear, a personal value, a core value. And they spend some time looking at the different works of art in the gallery and then choosing one and spending some time with it, using some of those close looking skills. And then we all join together and go on a tour. And it's not an expert guided tour, but it's a personal responses tour where people will guide us to their work of art, and they'll talk about the work and they'll talk about their value. And then we ask them a follow-up question, which is, how will you give expression to that value in your role as a medical student or a resident or a doctor or a nurse? And that pulls for connecting your personal values with your professional identity. So it really helps, in working on professional identity formation. And it's also just fun because these kinds of questions and explorations pull for stories, and you learn a lot more about people than you would if you just asked them to introduce themselves, which would probably pull for just a recitation of their CV. So I often will use museum-based experiences in relationship building, especially when people are just getting to know each other. It's incredible how these works of art can serve as metaphors and allow people to talk about things that might be difficult if you didn't have the quote unquote third thing there to discuss.
Thank you. It was quite powerful experience in that museum. We all participants had different experiences, even though we are looking at a same piece of art. And I think we learned from each other quite a lot during this exercise. Now, you mentioned about that you take medical students to the museum. Now, apart from VTS, are there any other ways that you can use the museum setting in health professional education?
Yeah, sure. So one way is that sort of personal responses tour that I just described. That can be very powerful. I usually start with VTS because it kind of primes the pump and it gets people into the mode of close looking, but you can use the works of art as reflective triggers. You can actually spend time close looking as almost a mindful practice. And at the Museum of Fine Arts in Boston, we now have a Rothko exhibit. And Rothko, the artist, invited people to actually spend time, to come very close to his paintings and to spend time just looking and immersing themselves in a very mindful way in his work. So we'll often do mindfulness exercises with those particular works. in the museum setting. Sometimes we give people the opportunity to just um, walk quietly in the museum and um, see what they notice, and we actually ask them to complete a phrase, and I notice, and we recite those responses out loud, almost in the form of a spoken poem. And some people notice their own heartbeat. Some people notice order and chaos within an abstract work of art. It's fascinating to hear how many different observations people have within a museum, and to hear them all together. And the act of recitation actually creates almost an art form in itself, like a poem. So we use it in reflection and renewal. We use it to support sort of mindfulness and noticing. We use it to have challenging conversations, or to talk about challenging conversations in healthcare. I remember bringing a group of learners to a 2,000-year-old grave stele from ancient Greece, and it was a child's grave, and there was a picture of the child, an image of the child, and her pet, and a toy in her hand, and somehow standing in front of that ancient work that represented a family's grief and loss, we were able to talk about giving bad news and consoling people who had lost a loved one. So there's something remarkably evocative about being in the presence of art that somehow allows you to achieve really depth of revelation and emotional safety at the same time, because you can talk about your own experience, but if it ever gets too personal, you can kind of move back to the work of art. So the work of art serves somewhat of a modulating function in that way. And so there are many. We talk about spirituality and cultural competence, and you really if you work, and this is one thing that I really want to make sure I point out, is the importance of having museum educator colleagues, or to try to find museum educator colleagues that you can collaborate with. I've had wonderful collaborations with people like Ray Williams, who was the director of museum education at the Harvard Art Museums, and now he's in Austin, Texas. And Judy Murray, we just talked about, Corinne Zimmerman, who's at the Isabella Stewart Gardner Museum. These people are all my mentors and role models, and they've taught me a lot about the uses of museums. We do exercises on communication, where we have people. We call it back-to-back communication. They sit back to back, and one person's looking at our object, and the other person who's facing in the other direction has a pad of paper, and the first person is describing the art object that they're looking at, and the other person has to try to draw it just from the description. And at the end, after 8 or 10 minutes, the work is revealed, and then there's a debrief. The debrief in all these exercises is very important, because you learn a lot about communication. And even though you feel that you are communicating something very clearly, you're looking at that work, you're describing it to the other person, and the other person feels that they're listening really well and following your directions really well. Often, as you can imagine, what is drawn looks different from the actual object. And then by analyzing it, you can kind of deepen your understanding about some of the communication issues that and problems that happen just in day-to-day work with other human beings. So there are insights like that we gain. And I've learned about all these different methods from my wonderful museum educator colleagues. It's great to have those sorts of collaborations if they're accessible to you.
Thanks, Liz, and that's really interesting. And I must admit that I never even thought about using the museum as a tool for health professional education. Now, obviously, it is very different to traditional teaching method that we used to go to classroom, or we used to go to clinics, or we used to go to the hospital near the bedside and learn from patients. Now, going to museum is something quite unique. Now, how do the learners react to these sessions? What's your experience?
Well, sometimes the museum experiences are elective, and so those participants are self selected and they tend to love it and be very engaged. But as we make more and more of these museum based experiences required for our learners, we're absorbing learners who may not have sought out this initially. But still, in my experience, they readily engage. They may be a little hesitant at first, but they find that there is something liberating about being in an environment which is not high stakes, there are no emergencies, and they see the relevance to the clinical work that they're doing. So they really tend to appreciate these opportunities.
If upcoming educator wants to learn more about this teaching method, what are the resources out there so that we can learn about this method and we can practice this method?
Well, as I just mentioned, I think if you have a local art museum, reach out to your museum educator colleagues and just have a meeting and see how you might collaborate. There is a website for the VTS method. It's called vtshome.org, vtshome.org. There is a collaboration of art museums and medical schools that has met at least once for a large group meeting in New York at the Museum of Modern Art, and that that organization is kind of coordinated by a museum educator named Bonnie Pittman from Dallas, Texas. I don't have the web link right handy, but I bet if you Googled Bonnie Pittman, you would find out more about this organization. And she's actually sort of developing a repository of materials. And then finally, and Swapnil, this is brand new news, so I don't even think you know about this yet, but we have been talking with the leadership of the Harvard Macy Educator Program and other collaborators about having a museum health professions educator fellowship where
Oh, wow.
people come together. It may be a six to 8 month fellowship where people come together twice in person in the museum setting. They apply with a project that they want to implement in their home institution that involves museum based education. There are readings and learning, and we'll have project groups where people can consult to one another. And then they can actually pilot their projects and get feedback. And we're going to try to time it so that it aligns with the Harvard Macy Educator Program. It happens just before that starts, so that we may be able to use some elective time with the scholars who can partake in some of the exercises that these museum-based med ed fellows come up with. So that's just in the works. So you want to we're trying to get it done for the 2019 Harvard Macy year, but it may be the following year. So keep an eye out for that. I think we'll probably take somewhere between 10 and 15 fellows in the first cohort. And people we hope will come away with lots of skills, including being expert facilitators or at least competent facilitators at VTS, and learn some of these other methods for museum-based health professions education, and be kind of leaders in the field. Really advocate for incorporating this kind of creative work in the health professions education environment.
That's really exciting news for all the budding educators out there. And I must say, don't miss this opportunity and definitely join this fellowship program. Now, one more like interesting question that I have is obviously you're very lucky to have these big museums within the campus. But is it mandatory to go to the museum to practice VTS, or I can put up a painting or PowerPoint slide on the screen
Yeah.
and use that as a VTS?
Well, yeah, yes, we are very lucky, and there is nothing like working with original works in the museum setting, uh, as well as getting out of the classroom or hospital environment. But yes, you can do VTS with PowerPoints and project images. You can also do it with hospital art. So we sometimes don't think about the art resources that are available to us. And in many hospitals and clinics, there are works of art that could work very well with for a VTS conversation.
Okay. Following on that question, how do you choose a painting or a sculpture for VTS?
Well, I'll often defer to my museum educator colleagues who are more experienced in the selection of works. But we try to choose works that are not too abstract or too busy. Um, and it's good to have one or more people in them. It's you know it's often interesting to look at facial expressions or relationships between the figures in a work of art. Often there's ambiguity, and that can be a very rich source of conversation. Another thing I don't recall that I've mentioned yet is um, these sorts of conversations are very good to help learners tolerate uncertainty and ambiguity, which is so much a part of medicine because it isn't about a right answer. It's about making meaning. It's about always searching for more. You learn a lot, but you often do not tie things up in a neat bow, right? So that can really it can be really useful to um, help our students and residents and faculty to appreciate that healthcare is about um, always learning, but simultaneously holding uncertainty.
Obviously, each method will have its own challenges. Now,
Hmm.
if as a health professional educator, I'm planning to implement this method in my teaching, what precautions should I be taking while using this method in a higher professional education?
Well, I think as human beings, we often fall into habits, and so it can be easy to fall into your usual small group facilitation techniques or PBL facilitation techniques. And this, just have to remember that VTS is a very specific method involving those three questions I mentioned and specific facilitation techniques. And it's not about getting the learners to say certain answers or teaching points. It's very a very different method of engaging people. So I guess my precaution would be aware of your own habits as an educator and try to um, bring your beginner's mind to this new experience and try to learn. And it takes a lot of practice actually to become even just basically competent at VTS because of those habits we've developed in other teaching and learning settings. So lots and lots of practice is important. Practice and feedback from people who are experienced with this method.
Thanks, Liz. And last but most important, what's your advice to budding educators?
Well, my advice, I had a mentor named Dan Fetterman who really just said his advice to medical educators were three things. One, stick to the basics. Two, think out loud. And three, be kind. And I think those are mine too. And I would also say, most of all, have fun and enjoy yourself. Because teaching is such a privilege, and it's also an opportunity to always learn.
Oh, that's really great advice, Liz. Thanks a lot. Now, if our listeners want to contact you and they want to discuss this methodology in detail, if they want some tips, more tips around this, or if they have any questions about this methodology, what's your best contact details?
People can feel free to email me. My email is Elizabeth underscore Gaufberg, Gaufberg at hms.harvard.edu.
Thanks, Liz. It was a pleasure talking to you, and I think I learned a lot, and hopefully our listeners will learn a lot. And this is just the beginning of conversations.
Oh, it was my pleasure, Swapnil. Take care.
Thanks, Liz.
Okay, bye bye.